Our next story today is about a smoldering public health crisis, obesity. It's not just a health epidemic, it's also an economic time bomb. And this concerns all of us. Half of the world is on track to be overweight or obese by 2035. Half of the world. So who will be the most affected? And can anything be done to stop this? We'll get to that, but first, what is obesity? Obese is a medical term. It is used to describe a person with high body fat, and it's not the same as being overweight. If you have a body mass index or BMI of 25, you're overweight. If your BMI is 30 or above, you're obese. Obesity causes health problems. It increases the risk of cancer, heart disease, and diabetes, among others. And why are we talking about it tonight? Because a recent report has raised concerns. It has been published by the World Obesity Federation. It warns that more than half of the world's population will be overweight or obese by 2035. Now, to put this in numbers, 38% of the world population, about 2.6 billion people, are already overweight or obese. 2.6 billion people. But in 12 years' time, this will increase to 51%. That's more than 4 billion people obese. Do you know what's even more worrying? Obesity rates are rising fastest among children and adolescents. By 2035, it could be double the rate seen in 2020. It's expected to rise by 100% among boys under 18. This will affect 208 million boys. And it's worse for girls. The rise of 125% is predicted, affecting 175 million girls. And obesity is not just a health concern, it has a real economic cost. So the global cost of obesity is also set to shoot up from about $2 trillion in 2019 to more than $4 trillion in 2035. That's how much obesity will cost the world. This would be about 3% of the global GDP. And the world's poorest countries will be the worst hit. They will see the sharpest rise in obesity, especially low and middle income nations in Africa and Asia. They're going to be the worst hit, and they're the least prepared to confront it. We are talking about countries like Niger, Papua New Guinea, Somalia, Nigeria, and Central African Republic. And which are the countries that are the best prepared to deal with obesity? Rich European nations like Switzerland, Norway, Finland, Iceland, and Sweden. And let me explain why. What is the relationship between obesity and poverty? Fast food. Fast food joints are more common in poor neighborhoods. Studies say people with a certain level of education tend to focus more on fitness, and this is a global trend. Either the poor are starving or they rely on junk. Those who have money and education have access to healthier food. So how do we fix it? As individuals, we can keep our weight in check with regular exercise and a balanced diet. You already know that, so I'll not dwell on it. But this is not just about individual willpower and lifestyle. Obesity today is a policy issue. Solving obesity is the same as solving inequalities. Governments have to step in and take decisive action. Experts say increasing taxes on unhealthy food is going to help. Ban junk food ads during certain hours of the day. Put warnings on food packets. Provide healthy meals at schools before the problem becomes too big to ignore. 1 in 7 people is obese today. This could become 1 in 4 by 2035. And a decade may not be enough to reverse this.